when someone is in the midst of a rumination, they are in it. They can't self-reflect. They can't get it to stop. And it's hard to work on it. And for a lot of kids, either exposure therapy or CBT can help. For some other kids, and some kids who also have a touch of attentional difficulty, it's boring to them. They can't get into the work. Or they don't see that it's a problem. They actually are in the rumination and they believe it. They're in the obsession and they believe it to be the case, the fact, the thing that there is no, that's reality. And because kids are not, in many ways, articulate about what they're experiencing, and because they're so embarrassed by it, you often don't get a sense of this until you open the system up and you get another person in. Now, a lot of other kids, then we'll get back to following up on this if you want. A lot of other kids don't need to go for a medication evaluation and can work on it in many different ways. But in this particular situation, the mission of childhood was being lost in that she was unable to have fun. Mm-hmm. She was unable to have a good time. She was unable to keep up in school. We underestimate how life for kids moves on very, very quickly. You lose a season in school as a child, and it's not like losing a season when you're an adult. You have very little freedom of choice in these matters. So something, in some way, again, whether it's a different treatment, whether it's a different approach, whether it's another therapist, something needs to be brought in to try to help this child move on with his or her life.